To discuss a 14-year-old female child came for X-ray with a complaint of multiple bone pain. This is the X-ray series of this patient of a 14-year-old female child. This is the X-ray of the right knee with leg. Here there is evidence of pedunculated. This is the pedunculated medial aspect of the proximal part of the right tibia, which is measuring approximately 4.2 into 3.2 centimeter from the cortex. This pedunculated structure, which is continuing with the parent bone, is suggestive of the exostosis. Also, there is another sessile bony growth on the medial aspect of the proximal a part of the right fibula, measuring approximately 3.8 into 2.4 centimeter from the cortex, which is continuing with the parent bone. This is suggestive of the exostosis. This is another X-ray of the same patient with the elbow with the forearm and the right forearm with the wristum. Here we can say the distal end of the ulna is not visualized with the shortening of the length of ulna. Proximal end of the radius had not showing the articulation with the capitulum of the humerus, as it could be because of the dislocation. There is evidence of sessile bony growth at the distal end of the ulna of size approximately 13 into 9 mm from the cortex, which is continuing with the parent bone. So this is also exostosis. This is the chest X-ray of the same patient, and here we can appreciate there is evidence of the bony growth. This arrow is indicating toward the bony growth on the medial aspect of the left humerus, a size 15 into 6 mm, and medial aspect of the right humerus. This arrow is indicating to the right humerus with measuring 13 into 8 mm from the cortex. This is also continuing with the parent bone, the suggestive of the exostosis. This is the another X-ray with the right leg with the ankle. There is evidence of sessile bony growth from the lateral aspect of the distal end of the right tibia, measuring approximately 3 into 1.4 centimeter from the cortex, which is continuing with the parent bone. So this is the exostosis. This is the case of a typical multiple exostosis, pedunculated and sessile, in a just 14-year-old female came to department with a multiple bony pain.